Well, even as we look towards 2021 with some hope, the pandemic has been the biggest health and economic crisis the world has had to deal with. Comparisons have been drawn with SARS, the global financial crisis, the Great Depression of the 1930s even. Unprecedented may be a cliche, but it's become the adjective for 2020. For a closer look at the economic impact of COVID-19, we're joined by Cheng Tsung-Mei, a health policy research analyst at Princeton University. Ms. Cheng, even with multiple vaccines on the horizon, can economies realistically be reopened fully? And if so, how soon are we looking at?
I think with the coming of the vaccines is certainly a very, very good news that we're beginning to see the beginning of the end of the crisis, hopefully, at least at first in rich countries. But then I think economic recovery really depends on how quickly you can roll out the vaccine and how many people in your country you can cover. And this will vary from country to country. And of course, the richer and developed countries will do much better than the low and middle income countries who will need help from the international community. So I think to say that the vaccine is a panacea, no, that is not the case. It certainly helps a lot. But all the other known, proven precautions like mask wearing, social distancing, don't go to crowded places, all that should still be very much in place.
Well, many countries are trying to reopen stores and boost their economies, at the same time maximizing public safety. It's a difficult line to walk. Is it even possible in your eyes?
I think really yes and no. That really depend on how, you have the public health measures put in place. Just to say it, in America, for example, we say that, our advice is you wear a mask, keep social distancing, but still we don't have a national mask wearing policy. So then when such measures are not clearly stipulated and strictly enforced, it doesn't help with containing the spread of the virus. And that is why actually we had seen the second wave in Europe, and now some countries are entering the third wave of the pandemic. It is because they rushed to reopen, and then they did not follow through with the enforcement of the preventive measures that they said the public should observe. And so we're seeing, very different outcomes.
So, Ms. Cheng, from what you're saying, would you say that to minimize the disruption or even the devastation of economies would depend then on how seamlessly governments and the public health officials work together?
Exactly. Well, public health officials really, they are a part of the government. And so the close. Well, first of all, the government should have very clear objective and a national policy at the top, and then work with the public health agencies, officials to carry out the policies. I give you an example of some very successful cases where the spread of the virus had been prevented, and in another case, contained. I'll just mention Taiwan and Victoria, the province of Victoria, city of Melbourne in Australia. In Taiwan, the government had a very clear objective when they first found out that there was this virus, new virus, early in January of this year. And immediately the government jumped into action, organized everyone, the CDC, the National Health Insurance, the Immigration Office, and all of that. And so together, they prevented the invasion of COVID. So today they have still just under 700. It's something like 671 cases and 7 deaths. So they clearly very successfully contained the community spread of the virus. And the economy is, as a result, growing in 2022 when everybody else has experienced economic shrinkage. And Melbourne, for example, also back in the fall, earlier in the fall, they were having they were concerned about the rising cases of COVID. So the government said, okay, we will set a policy. It says a zero case policy. And then they had a set of public health measures and they strictly enforced them. And as a result, I think for now, something like 4.5 weeks, maybe 5 weeks, they haven't had a new case of COVID. And the third quarter 2020, the Melbourne economy grew by something like over 3%. So we can clearly see that the economic activities, economic recovery is really a function of how well you have controlled and contained the virus.
Yes, and with that in mind, governance is incredibly crucial and important. Thank you so much for sharing your thoughts with us. Ms. Cheng Tsung-Mei, Health Policy Research Analyst at Princeton University.